I'm Lisa Casey. I'm one of the family practice doctors at Shawnee Family Medicine here in Lima, Ohio. I'm with Dr. Prey, Dr. Ackerman, and then we have a great nurse practitioner too, Jamie Blackburn, who has just started working with us. We've also got a psychologist here, Kurt Brickner, who has been really helpful also with some of the preventive medicine that we've been doing. I was asked to speak today about preventive medicine and something that we're very passionate about out here at Shawnee. When I think about preventive medicine, I think what we're trying to do is prevent the disease or stop the disease from happening in the first place. Or if they do have the disease present, catch it in very early stages so that you don't have to have a lot of treatment for the disease. So that's how I picture preventive medicine. And then when we're trying to figure out, okay, what are we going to do for the patients when they come in, we do a lot of, we follow guidelines a lot from the U.S. Preventive Services Task Force. And that's a group of experts that get together and decide which tests make the most impact in people's lives at preventing this disease. And then when you look at all those, they have recommendations A, B, C, Q, I. When you look at all those, the best recommendations, A's and B's, we really strive to get all those done when you come here and have a visit here at Shawnee Family Medicine. We kind of think of preventive medicine in three different ways. One is the behavior of the patient. So we're kind of looking at the behavior. We also look, when they come in, we look at the patient and we look for signs of any disease. The signs are things like higher blood pressure. Maybe if the patient comes in and they continually gain a little bit of weight, maybe there's something else going on. If the patient in their history talks about falling, well, that's probably something we should look into a little bit more as well. So a lot of the history that we're doing in the physical exam, we're looking for the very beginning stages of diseases. And then there's the testing aspect. And sometimes people have absolutely no symptoms, but we can pick up a few things if we do the testing. Usually it's blood work and then some of the other testing for cancers and such. When we do the blood work, a lot of times we're looking for the diabetes, but you can even find diabetes, pre-diabetes or glucose intolerance when the blood sugar is just starting to rise and there aren't any effects on the body yet, but you can still tell that. And so we're trying to pick that up in the blood work, as well as cholesterol and all the diseases that happen when you have high cholesterol and fats clogging up your arteries. It's going to cause heart attacks, strokes, and things like that. So we're trying to look for anything that the blood pressure is doing, any damage to any of the organs. We'll do that in the blood work also. One of the things that we're looking at, especially in women, the DEXA scan. It's a short x-ray that you take on a couple areas of your body, and it can tell us if your bones are a little bit too thin. And it's way better to prevent a fractured hip or a fractured femur or a fractured arm. So sometimes we can look at your diet, look at your exercise, or we can give you a medication to help the bones get a lot stronger also. So that would be another preventive thing that we love to, we get excited to prevent that. Then when we look at prevention, we also look at the cancers. The Preventive Task Force recently has decided that genetic counseling is a grade B recommendation, which means if you come in and you've got a family history with lots and lots of cancer in the family, we probably should sit down and try and decide, would getting your genes tested be a good idea? Some people it is a good idea, some people it's not. So you really need to talk to your doctor about if that's a great decision or not. But that would be one thing we can do. And if you are gene positive, then there are a whole new set of recommendations on what we should do because it doesn't mean you're going to have cancer if you're gene positive, but it means we really need to work on the lifestyle. We really need to do a lot more surveillance. So let's say you had the breast cancer gene that was positive, we would know, okay, well, you have to do a mammogram every year, and we might add MRIs or ultrasounds to that also, just so that we make sure we would catch it at the very beginning stages. And then some people can decide what else they want to do if they're gene positive. The major cancers that we're trying to prevent, the most popular ones, breast, colon, lung, and cervical cancer, which isn't the most common, but Those three things people are mostly familiar with. So we really do urge you to get a colonoscopy when you turn 50, but there is the FIT test. We can do some other things as well for the colon cancer if you're really afraid of that colonoscopy. But we really urge people to get the colonoscopy at age 50, because if you find colon cancer at the beginning, you just take it out. There's no chemo, no radiation. It's just so much better for everybody. The mammograms, most people are familiar. You start around age 40 every other year, and definitely at age 50 you want to get a mammogram for sure. So that's the mammogram for that. And then for the pap smears, that's for cervical cancer, and we usually try to start around age 21. And in the 20s we do it every 3 years, the pap smear. But then when you turn 30, if you had some small additional testing, HPV, you could possibly go every 5 years. And we do the pap smears now until the age of 65, and after that you're off the hook. So we really like all the preventive medicine aspects here at Shawnee. We're really excited about preventing disease. We'll definitely take care of you if you've got the disease too, but that's something that we're trying to stress is, hey, let's catch it at the very beginning so you don't have all the side effects and the problems that come with the disease process. And one of the things I like to stress with the patients too, when they're thinking about that colonoscopy, which nobody wants to get, that we're working on the prep, we're getting better at it, but it is true, you need to empty your colon the day before you get a colonoscopy. So, if we do that very quickly, then that is a little more uncomfortable. But we're working on those preps, and so different GI doctors, a gastroenterologist would be the one doing the colonoscopy. But even as uncomfortable as that might be, if you found a cancer and you removed it in the polyp stage when it's just as big as the tip of your finger, that's way better than waiting 5 years. If it grows into the side of your bowel, you might have to get a bag on the side of your body where a stool comes out for a while. I mean, it's even though it seems very inconvenient, you are saving yourself so much heartache and stress and time off of work and in the future. Even if you wouldn't die of the colon cancer, even if we caught it in time, that it just was, you just had to get part of the colon removed, you didn't need chemo and radiation, that one colonoscopy is going to save you so much in the future in terms of time, energy, stress, and overall discomfort. So I try and even though the mammograms might not be fun, the ultrasound might not be fun, the surgeries and the recoup time from that is so much more extensive if you find it early when it's very, very small. So I really urge my patients, especially when they say, oh, can I just put it off till next year? I'll say, okay, but you need to remember, this is what you might be, you might not be putting off the pain and the discomfort, I'd just be tripling it actually in the future. When you're coming in for a wellness visit, there's a big difference between having signs that we need to work up and coming in, you feel absolutely great and fine. Some people don't come in for that wellness visit because they think, I feel fine. Why would I go into the doctor? That's a copay or whatever. But if you could come at least once a year so that I could listen and I could ask you questions, I might find something that maybe we need to work up. And there's a big difference between having symptoms and coming in to work it up than me saying, okay, well, this is what we usually do for people about your age to make sure you don't have any diseases. I listen to you, get the blood pressure, do a little bit of blood work, and then we'll check maybe immunization history as well, and we will go through the different tests that, hey, now that you're 50, these are the tests that we recommend, and have a discussion about it at least. So I would say make sure you come in even if you're feeling great. Now, if you are having some signs and symptoms, if you're having signs of breast cancer, would possibly be, if you've got a lump that keeps growing hard. Usually, cancer is painless, but sometimes it can be irritated. Or if you've got lumps underneath your arms, that could be a sign for breast cancer too, guys or girls. Make sure you come in and get checked out. The colon cancer, usually we're looking for signs of diarrhea alternating with constipation. Any blood in the stool makes us worried that maybe there's a polyp in there. As the stool goes past, it gets, wipes off the top of it or something and causes a little bit more blood. So any blood in the stool, we definitely want you to come in and talk to us. And sometimes, we'll just do an exam, but many times, depending on what the symptoms are, we'll say, hey, let's go ahead and get that colonoscopy and make sure there's not something else going on. Cervical cancer really has no symptoms, really. So that's why it's so important to get the pap smear, even if you feel fine. We do also do preventive medicine tests for lung cancer. So if you've been a smoker and you're 55 years old and you've been smoking up until the age of 55, usually we'll get a high resolution CT, which is very low radiation, but we need to do it at least one time just to make sure there aren't any nodes or nodules in the lungs. Many times people have absolutely no symptoms or signs of lung cancer until the cancer has spread to be much bigger, and then you'd have to have surgery. And so we usually try and find those nodules when they're really, really small, and follow sometimes we don't do anything with them, just follow them, but knowing you have a lung nodule and you're a smoker definitely increases the risk of cancer. And sometimes we'll get a lung doctor involved too, just to better be safe than sorry. So I would say the easiest thing to do as a patient, just make sure you go and see your doctor once a year. There might be some new tests coming out. You don't have to worry about keeping track of all this stuff. Your doctor's supposed to do that for you. So if you come in every single year, it might be one year we didn't check your cholesterol, but next year we'll be sure to get it. It might be another year we might have forgotten to remind you to get a pneumonia shot or one of the immunizations was good. But if you come every single year, whatever we've missed in the past, we'll catch up this time, and anything new you won't have to worry about. You just come in, it's your doctor's job to worry about that anyway. So I would say the best thing you could do when you're thinking about all this preventive testing is just to make sure you see your doctor every year.